Okay, hello, good afternoon everyone. So my name is Annapurny and I'm a pediatric dentist and currently working at UITM dental faculty. So I'm going to be bringing some dental stories today, and as you know, I think dentists are the most feared people, and being a pediatric dentist, we appear to be big monsters to most of our patients because dentistry is definitely known as one of the most anxiety inducing. And I'm sure there are a lot of adults, some of you secretly are afraid of your dentist too, because I think we come from, a lot of negativity that says, if you don't do this, the auntie is over there, she's a dentist, she's going to pull out your tooth. So, dentistry has always elicited some form of anxiety. And, from a historical point of view, we have, now we have evolved, we have better dental equipment, we have nicer dentists, and, but yet the level of anxiety remains the same. If you talk about 1900, 2022, the level of anxiety, they've done a lot of research, remains at about 30%. 30% who outwardly can, portray that they've got dental anxiety. However, anyone who comes to the dental clinic, just because they don't jump off your chair, it doesn't mean they're not anxious. Almost everyone comes in with some form of anxiety, but we tend to control that anxiety. So in dentistry, many reasons on why we could have anxiety. It could be a bad experience in the past. A lot of our patients come in with multiple problems. So they're already seeing medical for different reasons, and always going in for blood tests, always going in for so many things. So they become much more anxious when they come to seek dental treatment. And the mouth is somewhat a very personal space. So I think it's quite, you feel very embarrassed, very reluctant. So that's another reason why we have a lot of anxiety. And sometimes, unfortunately, it's a lack of communication, lack of empathy, and patients tend to be more anxious. And anxiety is definitely, it's a very vicious cycle because someone who's anxious will then try to avoid treatment. When they avoid treatment, the treatment need then becomes more severe. The problem becomes more severe, treatment becomes more complicated, and when there's a more complicated treatment, the pain that comes along with it is probably also more. So this is a vicious cycle, and so patients who have anxiety end up having more dental problems. Patients with a lot of dental problems most likely have anxiety. Okay, so I'm not saying this, research is saying this as well. So this is a big problem that we deal with in dentistry. So it was pretty much the story about how we started hypnosis in dentistry at UITM is because a couple of us jumped into a car one day, decided to go and check out LCCH because they were offering a course certificate in hypnotherapy, and so we decided to take up the certificate course. Most of us probably did it for personal reasons, not mainly for dentistry, it was more for personal reasons. But when we went in and we completed the course, we said, hey, look, I think we can help our patients. This is helping me. My self-care, we have different levels of anxiety, we have other issues. And so if this is helping me, could it help my patients too? So then, and I must say, for many of you, when you first see it, you say, just speaking these words, how is it going to, even we had that sort of skepticism. But the good thing, I would say the positive thing is because we went as a team. I think if I had gone in myself, I would have been reluctant because people are going to look at me and say, hey, what are you doing? So I didn't have that confidence to deliver. Like what Prof, because I'm so used to hypnosis, when Prof Marzida delivered, I was already getting into my zone because I'm so used to that. But so what we did at my center, if I'm the operator, if I am doing the dental treatment, my colleague is there, she will be the hypnotherapist. So that's how we sort of motivated each other. When she is doing her cases, I would jump in to be the hypnotherapist. So because we had that sort of teamwork, now I'm able to go out there and do it. Do it by myself. She's doing it. There are a couple of us there, and we are able to do it. But I think that was, for me, I believe we were very, very blessed because we had a team going and learning that together. So why it's been working for us, I think we started in 2015, I think, 2014, 2015, and to now it has become like a daily practice for us. Initially, it was like, you know, I used to have anxiety, oh, tomorrow I'm going to do hypnosis, is it going to work? But now it has been incorporated into my daily, you know, how I approach my patient. That means anyone who walks through the door, sits on my chair, I'm not going to try to evaluate how anxious are you. I already offer them the positive language, because that language is very important. And so patients who don't appear anxious as well, they benefit from it. You know, to have a patient on the chair, have a dental treatment and say, yeah, I enjoyed that. You don't expect people to enjoy your dental treatment, but it is possible. It is possible to offer a relaxed situation for these patients. So I use a lot of nitrous oxide. We use a lot of nitrous oxide at our place as well. And I started noticing that the results that I got with my patients with hypnotherapy is comparable to nitrous oxide. So when you deliver nitrous oxide, you will look at, when you're adjusting, you will look at them and you will see the changes. You will see the changes, how they become more relaxed. You see the breathing pattern. I was seeing the same exact thing with hypnosis. So one is pharmacological and one is non. One is definitely more expensive. And, you know, so when we started seeing that, we started using hypnosis as an adjunct. So we would deliver nitrous oxide, but also do hypnosis at the same time. So in the beginning, when we delivered nitrous oxide, after some time, what we did was we would turn back to 100%. So we turned the dial to 100%. Patient was still in that state of, for us, it's a state of trance. But the patient was, it's as if the patient was receiving nitrous oxide. So when we turn it back to 100, so I had my postgraduates there, and at the end of the session, even though it's already 100% oxygen, we had to awaken. Like Prof Marzida said just now, she was counting 1, 2, 3 for awakening, 1, 2, 3, 4, awaken. It was only when I did the awakening that the patient is actually fully conscious. Patient is conscious, but in that state of, you know, dissociative. They're there, but the mind is focused on something else. So when I do the awakening, then they are fully back. So after a while, we became confident. Hey, look, maybe I don't even need to deliver nitrous oxide. So we started doing that with the patients with positive results. And because, as you know, in dental treatment, sometimes they have to come for multiple visits. Some of you may have had root canal therapy. It doesn't get over in one sitting. You have to come back, and you have multiple teeth that need treatment, or long-term, you know, treatment. And for them to keep coming back and for you to give medication is probably, you know, it's better if we could get them to be more relaxed. And so for all the subsequent visits, we are just using words. So what do we use it for? Definitely pain management, and to get an anxious patient to be on the chair to do, because it's not easy to get GA time. We can't be going in and out for GA for multiple visits as well. Okay, and in dentistry, we have habit breakers as well. A lot of them come in with thumb sucking, smoking, and so actually it does help to quit certain habits as well. And you may have heard of like orthodontic appliance, patients who go in for braces, or sometimes it's an appliance. So when it's braces, it's fixed to the teeth. Appliance, we need the patient's cooperation and compliance to wear the appliance. If they do not wear it, you will not get the results that you expect. So sometimes being in young patients, we need to encourage them. So hypnosis, the good thing about hypnosis is you can instill these values. You can instill this for long term. That means, like what Prof said just now, you can include a message. Okay, when you go back, you know, in order for you to have this successful treatment, you will remember to wear your appliance 8 hours a day or during this particular time. And it helps, because it's subconscious. So you don't realize, you immediately take it and wear. You immediately do it. You don't have to keep reminding yourself. So in terms of that long term, and for the daily thing, like to brush, to keep it clean, it can really have very successful outcomes. I am just going to, okay, this is how we do it. The setting, you can have it separately. You can have it in we are quite fortunate. We have a hypnotherapy room in dental faculty at UITM. So we can do that. That means like the prep. Remember some of the patients they showed just now, you have to prep them before, a couple of days before or few hours before. Okay, so we can use that hypnotherapy room. And we also do chairside. So while we're working on the patient, we start talking to them, induce hypnotherapy. So a lot of cases we do, for me, I do a lot of chairside hypnotherapy. Or we can also send them home with some audio. Okay, I'm just going to do very fast some examples of how I use it. So I told you earlier regarding nitrous oxide, I use it as an adjunct because nitrous oxide also sometimes if the patient doesn't want to comply, the patient still has fear, it will not work. So by introducing together with the words, together with the nitrous oxide, I find that actually it's very much more easier to get a successful treatment. Needle phobia. I've had a couple of cases with needle phobia. Patient would scream and bring the room down. Okay, and I myself, this was one of my earlier cases, I was amazed that the patient was able to receive an LA because patient could not receive local anesthetic anywhere else before that. So the mother was completely, she was really shocked that her daughter was able to receive it. And all it took was actually speaking to the patient and desensitizing the patient. I've got one video here. This is one of my favorite cases. It's a patient with severe gag reflex. So what happens, and the patient needed some orthodontic treatment to correct his front teeth. And he needed to wear an appliance. And in order to do that, you need to get like a mold. You need to get a mold, get a model, and make this appliance. And this boy, if you put anything beyond his front teeth, you go in to check, you know, the mirror, the dental mirror, you put it in, severe gag reflex. And to take that, can you imagine taking an impression, putting something into the mouth, the patient could not tolerate. Even when we did the lower one, which is less sensitive, he would vomit. So how are we going to treat this patient if he cannot have anything in his mouth? How is he going to wear that plate? So the orthodontist said, we don't know what to do. It's a simple case to be treated, but we cannot do what we're supposed to do, which is take the impression and make this plate. So I said, give me a chance, let me try. So when I did with him, I did something known as a glove anesthesia. Glove anesthesia is that when I put him into hypnosis, I ask him to imagine that he has a special glove. And this glove, when he points or he touches any part, that part would become anesthetized. So he being a young boy and an Avengers, he's a fan, he says, I want to have Thanos. I want to have the Thanos hand. So I said, okay. So I incorporated that into the script that I gave him and I prepared him. And so I told him, whenever you feel like you're going to gag or vomit, use your powerful Thanos hand and anesthetize. So just touch it and that area will become anesthetized. And so I'm going to show you, let's see. It's a short clip. Oh, there's no sound. Okay. Basically, I'm speaking to him. So I was telling him that, okay, sekarang boleh gunakan tangan Thanos because you can see him, he's feeling a bit of a gag. And I told him, whenever you need, boleh pakai tangan Thanos. And you can see that he's putting his finger in. So he did not vomit, he did not retch. So he's using, he himself, his eyes are closed. So he's using his own fingers to anesthetize the area inside his mouth. We got the molds, we got the plate, we got him to wear the plate, and his teeth position was corrected. And the best part of it, the mother calls me up and says that he was having difficulty with swallowing tablets. He couldn't swallow tablets. I did this to help him with his dental mold, but it turned out that after that, he was able to swallow tablets as well. So that was really profound because we could actually treat him and you know, something that we thought was quite impossible because of his severe gag reflex. We also use a lot of it. We get a lot of cleft lip and palate patients who come in demotivated. They have a lot of self-esteem issues. So I've worked with a couple of them and, you know, it's really helped because some of them have major surgeries and to recover from major surgery and to get on and to take care of the oral hygiene, hypnosis has really helped. We've also had trauma that we need to do something on the chair immediately, because every minute loss means that that tooth loses its viability to be vital. So we replant teeth as well. So all this has to be done in a very, very short window. And we cannot be asking for GA to do that, because you have to do it within an hour or so. And so when the patient comes in, this patient that we got was so anxious, and the only way I could actually do that work on the chair was using hypnosis. So basically we were able to save teeth, we were able to reduce the dental injuries and to manage it on the chair, and now he is fine. He generally has very severe anxiety, and you know that with trauma we have very, very long treatment. Patient has to come in very often, a lot of work to be done, and I'm happy to say that we've been able to give him the best because we were able to manage on the chair. Okay, something done yesterday actually by my team members, by my colleagues, is taking blood. It's something that's very, very difficult for us as well, especially with severe anxiety. You can see the boy, his head is slightly slumped down. Very, very anxious boy. So they were doing a treatment where they extracted the tooth and they ground the root of that tooth to put it back into the socket. We call it a socket preservation, which requires taking blood from the patient as well, and something that was quite impossible without the help of hypnosis. So there's some of the cases that I wanted to share, and to also tell you how we are actually incorporating it. We have actually included hypnosis in both our undergraduate and postgraduate modules. So at UITM now, the students can come and observe. The undergraduate students come in and observe. They help us, and then they write a little bit of a log, a reflective diary to learn about hypnosis. The postgraduates attend the course, attend the formal course, and they get a certificate at LCCH. And we also include it in assessment and exams to make it part. So basically we've incorporated it into our module. So we are reaching out. I believe we are the first dental school to do that, but we are reaching out because we feel that we do have non-pharmacological behavior management that we teach. It's a big module for us in dentistry, and we hope that it will be something that every school will teach after this. I think it's just a tool that we should have in our pocket. It's up to you how you want to use it, but I think it's something that needs to be a tool that needs to be introduced to our students. Okay, I think that's it from me.